Hi, it's Dr. Noel Williams, COVID update, May 3rd, 2021. Who would think a year would go by and we'd still be doing this? Because I remember doing a post about the same time last year and making a crack about Cinco de Mayo, which is really just an excuse for me to have a margarita. And I hope those of you who like margaritas get to do that too. So we got to find the positives in the otherwise weird environment we're all in. So what's the COVID update? Well, cases are pretty stable in the United States, running, 40 to 60,000 a day. But some of that has to do with all the testing we're still doing. But overall, case numbers are looking good. Death rates are coming down. Oklahoma's doing really well. The big problem's the rest of the world. The rest of the world hasn't been vaccinated. India's at. Well, you're hearing about India. So India, if you're watching the news, India is 2% of the population has received 2 vaccines. 10% or less have received 1 vaccine. They're a rather large country, 1.5 to 2 trillion, or not trillion, billion. And so it's a problem. Now, the thing that happened is their weather's different than ours. So this is their version of December, January. So this is why we're having that problem there. It's going to get better in about 6 weeks to 8 weeks. And we'll just have to see what happens. They're talking a lot about variants again. That's just the hoofbeats of fear to get you all scared. Don't be scared. Again, as Fauci's own division showed in a paper, the vaccine and prior infection cover all the current variants. Now, these will be new variants, but the chances of one of them mattering is going to be scant because it's just the nature of viral illness. So again, it's a possibility, but I wouldn't be all that Twitter-pated about it, because if we've all talked about or discussed, take your vitamins, take your vitamin D, take a multi, you're going to be in good shape. If you're vaccinated, watch your blood sugars. If you're diabetic, do all the usual stuff. COVID's going to wind down. COVID's going to wind down. That's what I want everyone to know in the United States. And hopefully we won't have to be forced to watch the president in a mask everywhere he goes when he doesn't need it, when he's been vaccinated, and we don't need to have him give the State of the Union address or whatever he did the other night, and then have Kamala Harris and Nancy Pelosi act like they need to wear masks when they don't, because they're vaccinated. They don't need to wear masks. That's the whole point. And I don't know why they keep on doing it. It's manipulation and it's performative. We have to get to normalization. So that's what we need to do. Normalization. If you're vaccinated, you don't need to wear a mask. Take your vitamins, okay? If you're outside, you should never wear a mask. Sunlight kills the virus in 7 minutes. And that looks like it's the same in saliva. So the worst thing we can do is wear a mask when we're outside. I had a couple people in with double masks today, which was particularly humorous to me because they don't matter. And it's just fostering idiocy. But not that I said that, I just said you don't really need to do that. I was very nice about it, but if you want to, it's fine with me. And then I couldn't understand anything they said when you were talking, but that's okay. I mean, we made the appointments longer. But so that's really COVID in a nutshell. It's finishing in the United States. People need to get their vaccines. Get your vaccines. Get your vaccines. Get the Pfizer or the Moderna. It's straightforward. It's easy. You're going to be immune 99.9991% of the time from serious illness. I've gone over this. Get the vaccine. Now, should children get the vaccine? I've talked about this too. That's going to be up to their parents. I don't think children under really 18 should get the vaccine unless they're high risk. I don't think younger people in general who are low risk should get the vaccine, but that's me because I'm science driven and not an alarmist. And so if you're a low risk person, hey, I wouldn't get the vaccine if you're much under 21 to 25. But again, I'm going against the grain, but I don't think the risks of the vaccine outweigh the risks of the vaccine could outweigh the benefits, but hey, that's statistics. And you can believe who you want to believe on that, but I'm just being a realist. But again, my 19-year-old just got his because he doesn't want to be limited at school, and he's already had the virus, so it's particularly stupid, but he wants to be able to wear a mask, be at school, be on campus, and not have to wear a mask. And where he's going, they're going to have to be like that they have to get the vaccine. He chose to do it. He's an adult. He did get sick for 2 days with his first Pfizer, though, which would be as expected. He'll get a little more sick with the second one. So Kim, do you have any questions for me? Because I'm going to go on to other subjects.
Do you want the questions now?
Sure.
Okay. What are the percentage of people getting COVID after they've been fully vaccinated?
So there's not a direct number on that, but we know that there's been, well, we have a direct number, but the global number, it runs somewhere in the range of 10% of people get a COVID. I'm sorry, I did that completely wrong. Um, it's somewhere in the range of, I believe, 6,000 people out of 66 million have a documented COVID infection after vaccination, and they've completed the 2-week cycle. So it's somewhere, I think if I do the math right, 1 in 11,000. 6,000 times 11,000 is 66 million. And so then if you look at the death rate, it's 1 per 10 million. So about a 1 in 10,000 chance of getting a symptomatic infection, which makes sense. As we know from the Marine Corps data, that 90% of reinfections were asymptomatic, 10% had minimal symptoms. So it would make sense that roughly out of 66 million people, we'd have 6,000 get mild symptoms, and 1 in a million to 1 in 10 million get serious symptoms with only 6 deaths. So you're in pretty good shape once you get the vaccine. And again, safety isn't. Am I worried about something that's 1 in 10 million? No, I need to worry about walking my dogs more than I need to worry about COVID. I need to worry about everything in my life more than I need to worry about COVID once I'm vaccinated, which is why I encourage everyone to get vaccinated so you can get this behind you if you so choose. I have lots and lots of people that I talk to in the office who don't want to get vaccinated, and I try to talk them down from that. But if you don't want to get vaccinated with COVID, at least get your measles, mumps, and rubella caught up in your diphtheria, tetanus, pertussis, because they do give some cross immunity, and still take your vitamins. So that's what I would do.
So, of the people that do get COVID after they're vaccinated, say they get really sick, they're in the hospital, does their chances of survival or needing more critical type interventions go up since they had the vaccine and then got it? Like, are they going to get
So the first thing is, it is hard to put a number on the people who get seriously ill. It's probably, if 6 people died, we know at least 6 out of 66 million did. So about 1 in 10 million die. We don't know the exact numbers of how many got seriously ill, but classically it would be at least 10 seriously ill people for 1 death at least. So figure maybe 1 in a million for serious illness. So the bottom line is this: if you get the vaccine, you're protected 99.999% of the time from any kind of symptomatic significant illness. So that's pretty good. You can't get better than 1 in a million chance. It's better than flying. It's better than many things in life. It's better than chewing. Not joking. I mean, there's just so many things to worry about besides COVID, which is why we need to stop worrying about COVID once you're vaccinated.
Okay.
But again, get vaccinated.
Have you heard about people having intermittent inflammatory responses after the vaccine?
Yes, that's kind of the whole point of why we don't really want to. I don't think it's a great idea to give it to people who've already had COVID, because they're going to get more inflamed. We've had people who've gotten the vaccine after having COVID who had recurrence of their symptoms. I've had one person get hospitalized and back in the ICU after it. I've had another lady have complete recurrence of her symptoms, but not to the point of getting hospitalized. So you can get sick with COVID type symptoms after the vaccine, especially if you've had it. Now, people who just get the vaccine who haven't had COVID, they'll get some inflammatory responses. You'll feel tired. You'll feel worn out sometimes. I have tons of people who have had no symptoms, but I mean, I got tired. I felt worn out for several days both times. People can get rashes. People can get inflamed. They can have joint aches and pains, but all of it's pretty self-limited, 99% of the time. But again, it's about freedom. And in this country, since we're not in a state of freedom any longer, doing the things that get us freedom is helpful. Now, some of you may argue, oh, darn it, Spock, I don't want to have to do anything to get freedom because I should just have the freedom. Well, in a perfect world, Yes, but we're not in a perfect world anymore, and I don't think Joe Biden or those people are going to agree with that. So again, I'm for facilitating freedom. I'm for facilitating so people don't get COVID, and COVID's still out there. Look at India, and you can still get it. Now, are we going to have a pandemic again in the United States where tens of thousands of people are going to die further? No, we're not. We're going to have, yes, we're going to have more deaths, but this big surge of deaths that we had initially is done, and that would have all been avoided if, I'm sorry, if the FDA, CDC, Fauci would have done any of the things they were supposed to do. We would have lowered the death rate by 90%, I think, maybe even 95%, but that would have meant following the science, which we ignored. I've said this before, where science goes to die, the United States, with how public health works and mitigation strategies. So, but I think now at this point, we have the BAM infusions, we have doctors who aren't so terrified to treat you. So I don't think COVID is anywhere near as significant. That's why we should relax stuff. We need normalization. We need the public school scores. There are the scores of the math testing, 50% lower than last year. It's a lost year for, 80 million children in terms of education. What kind of win is that for us? We're going to do it again because after talking to, well, I'll be careful. I don't think school administrators have are terrified and they're fearful, and they forget one of the reasons you're a school administrator is to make tough decisions and to not be. That's why you get to be the superintendent. Make the decision. Look at what's best for the kids versus being paralyzed by fear. But again, I put myself out here, so I made the decision to get criticized, and they haven't. So I always want to give them some empathy. But they're responsible for the kids. Just like I made the decision to treat, between 400 and 500 COVID patients, so because I felt it was my responsibility to protect them, even though the FDA said no, let them die and see what happens. I said no. Why can't the school administrators say no? I got to take care of all the kids, not live in fear of, some astronomically low number actually getting sick. So enough of that.
And you may have addressed this in a past one, I can't remember. What about miscarriages happening after close contact with the vaccinated person?
The vaccine's not alive. Okay, it can't transmit. It doesn't transmit. The vaccine doesn't transmit from one person to another person, whether it's the Pfizer, the Johnson & Johnson, the AstraZeneca, the Moderna. They're not live viruses. They don't move from a person. It's a messenger RNA. So the Moderna and Pfizer are messenger RNA bubbles or exosomes that get incorporated right into the cells. The cells turn the messenger RNA into proteins, and the proteins cause an immune response. They're not given to other people. It's a cell-to-cell communication thing. It's not a person-to-person. Now, the dead vaccines, which are the AstraZeneca and the Johnson & Johnson, again, they don't transmit to people, so no, it has nothing to do with that. People miscarry. I'm sorry, I'm an OBGYN. The actual number of people the actual miscarriage rate, if you look at chemical pregnancy, is 65% in terms of, 65%, not 20, in terms of the clinical miscarriage rate where someone actually knows they're pregnant is about 25% or so, or 20, roughly. So again, people miscarry. I'd be more worried about getting pregnant and not having the vaccine because you can get microemboli, which can cause miscarriage and stillborn if you get COVID. And so that can damage the baby. It can cause miscarriage. It can cause all kinds of problems. So I would strongly encourage women who want to get pregnant to get vaccinated because they're in a little higher risk state for complications from COVID. So again, that's just science talking. And so, yes, I think pregnant women should get vaccinated or get vaccinated if they know they're going to get pregnant.
That's what I have.
So that's about it. So we're going to be switching focuses more on health related stuff over the coming weeks. I'm going to still talk about COVID and give updates, but I think the key concept is there's more to the world than COVID. There's more to health than COVID. There's great things we can do to help patients feel better, help people do well. And the other thing is let's think about critical thinking. Critical thinking matters. Let's analyze things and stop being lemmings. If you're seeing things that are in places where no one's thinking, start thinking, how do I get people to think? To challenge the belief systems. I mean, what do we need to do? I think that would be a great thing. Understand that people make mistakes, and one, we can forgive them and help them learn, and we don't have to judge everyone, which would be a nice thing. I do want to give a big shout out to all the people, all the nurses, all the hospital staffs, all the teachers, all the police officers, all the fire people, all the EMTs, all the home health nurses, all the people who've worked and worked and worked on our behalf during this crisis. And a big thank you to all of you once again for filling in the breach, as the saying goes, and saving people's lives and making families work. I had home health nurses in today whose job's gotten a lot better because they're not home health, a hospice nurse who is not having to deal with as much COVID. And I just made me think of all those hospice nurses everywhere who deal with death all the time, and then the overwhelming amount of death they've had to deal with post-COVID. So just be nice to people. That's our central theme, and that's it. Nothing big. I just live life. Go outside. Sunlight kills COVID. Get normal. Tell people to be normal. Give up the fear. Stop with the fear. Every time you see someone who's vaccinated wearing a mask, ask them why. Why are you wearing a mask? There's no point in doing the vaccine if you're not going to change your behavior. But be nice about it. I mean, don't cause problems, but be nice about it if you get the chance. Anyway, that's it, and take care. Good night.